Are you at risk of Alzheimer's disease? What is the year? What is the season? What is the date? Where are we? What's the town? What's the hospital? What's the floor of the hospital? The problem with all of this, diagnosing Alzheimer's disease, is quite imprecise. Hello, welcome to the Crossover Connections with Jack Wayne podcast. My name is Jack. I'm an Australian scientist and college professor at a university. Anyone can develop Alzheimer's. Usually we see it progress further and more aggressively the older you get. Physical inactivity, lack of mental exercise, as well as some general health risks around smoking, obesity, diabetes, cholesterol, and high blood pressure. This all may increase your risk. Neurocognitive degeneration, short-term memory loss, repeatedly saying the same things, having vagueness in everyday conversation, losing the ability to plan or problem solve or do routine tasks in a slower way. And this is the big one for family members if there is a change in behavior, personality, or mood. Diagnosing Alzheimer's disease, as you can tell from those list of symptoms, is quite imprecise. From a behavioral perspective, people could be going through a range of different experiences or maybe have some other mental health issues, and they will have all of these, if not most of these symptoms. And that's why, according to this website, there is no single test currently available to diagnose Alzheimer's disease, and it is almost a disease of exclusion once you've excluded all the other possibilities that are associated with those signs and symptoms. And the physician normally needs to take medical history, physical exam, blood and urine tests, and in some cases the cerebral spinal fluid, as well as psychiatric and neuropsychological tests and brain scans if it comes to that. The brain scans and the blood tests and the urine tests, they're more down my field, where we look at a very specific biomarker, or we're looking for a very clear lesion or a plaque on the brain scans. The way that people pick this up in their everyday lives is through the behavioral changes, the family members and loved ones that are best placed to notice those changes. People will lose mobility as well and become dependent, requiring extensive care, so they're in a constant state of distress. There is no definitive test for any form of dementia. There's not one gold standard that we can just use and we'll know that they have Alzheimer's. You can run blood tests to exclude other problems such as anemia, infection, or electrolyte imbalance, and also doing some urine tests to investigate infection. Outside of doing blood tests and PET scans and CSF scans is going to be these cognitive tests, where you go to a doctor and they administered this cognitive test to test your memory and learning abilities. Within a pretty short amount of time, you will have a baseline for your cognitive abilities. And if you do this every year, you'll know if you're declining over time. I am not licensed to give this kind of test, so I'm not going to administer one over the podcast, but I will say that the one that is the most accessible is the Mini Mental Status Examination, MMSE. It takes around 5 minutes to complete, and it is the most common test for the screening of dementia. So again, this is the Mini Mental Status Examination, the MMSE. You can very easily Google it to see the types of questions that are there. Let's see how I do on this Alzheimer's memory test. Again, the scoring of this is completely arbitrary now because I'm not licensed to give this, but I can try and attempt these questions. First question, orientation. What is the year? 2023. What is the season? In Australia, we're in winter. What is the date, day, and month? I believe right now we're in July and we're in 2023. The exact date, I'm not sure, so maybe I don't score full marks for this. Where are we? The state, we're in Queensland. What's the town? I'm in Brisbane. What's the hospital? I'm not in a hospital right now. What's the floor of the hospital? If my home was a hospital, I'm on the ground floor. Next one is a little trickier to administer by myself, so I might administer it to you. The key here is I have to name 3 objects. I'm going to take a second to say each of them, and then I'm going to ask you what these 3 objects are. A remote control, a pocket knife, some earphones. I'm supposed to give you 1 point for each correct answer here. You basically get an unlimited number of goes until you get all 3 objects right. Again, the higher the trials that it takes for you to get those 3 objects, the lower your score. The next one, serial sevens, attention and calculation. You start at 100 and you keep subtracting 7. And you do that 5 times. Unprepped, unrehearsed, 100 minus 7, 93. 93 minus 7, stumped already. 93 minus 7 is 86. 86 minus 7 is 79. 79 minus 7 is 72. 72 minus 7 is 65. For those of you listening on the podcast, you can double check me and leave a comment here to let me know if I screwed any of those calculations up. The alternative is to spell a word backwards, and the word here is the word world. So spelling world backwards. I'm going to try this again without looking at the word on screen. D-L-R-O W. Hopefully I got that right. Again, I'm not licensed to administer this to anyone, let alone myself. I'm just doing this out of curiosity. And at this stage of the mini mental state exam, you ask the person to recall what were the 3 objects I named earlier. You get a point for every object you get correct. And for those of you playing at home, the 3 objects I named were a remote control, a pocket knife, and a pair of earphones. 3 points for you if you got that right in this recall part of the mini mental state exam. The rest of the mini mental state exam doesn't really work over this audio visual medium. It involves the person writing a sentence and seeing if that sentence makes sense grammatically, logically, structure-wise, and then following a command where you're folding paper and putting it somewhere, and then copying a design which involves 2 pentagons that are overlapping. One reading doesn't mean anything. It's how you progress over time, and maybe this time next year, if you do this again, compare your score and test if your mental capabilities are staying the same, plateauing, getting better, maybe they're getting better, or if they're declining over time. I'm Jack. Hope to connect you again next time around.